everyone. Thank you for joining. We will begin in just a moment. If you have any questions during the conversation, please type your questions in the chat box. Good afternoon, everyone. My name is Diego Ortiz, Director of Communications, and on behalf of the American Heart Association of Westchester County, welcome to our special conversation, Brain Health and COVID-19, presented by Phelps Hospital Northwell Health. Today is April 29th, and that means May is just around the corner. And May is American Stroke Awareness Month, a month created to promote public awareness and reduce the incidence of stroke in the United States. You know, a lot of progress has been made in the fight against stroke since Stroke Month began in 1989. But today, stroke remains the 5th leading cause of death and the #1 disabler of Americans. As the American Heart Association and American Stroke Association, this month, and really throughout the year, we focus on educating people to recognize the warning signs and to call 911 to help prevent stroke by promoting healthy lifestyles, because 80% of strokes are preventable, and to promote stroke recovery and rehabilitation that helps survivors build strength and confidence after a stroke. And the way we do this is by raising awareness through conversations like the one we're hosting today, and by raising funds to advance our mission. So please consider making a donation to the American Heart Association and the American Stroke Association today. You can do so by texting Go Red 914 to 41444. That's Go Red 914 to 41444. Alrighty, thank you all. And now it is my pleasure to welcome Dr. Frasat Chaudry. She's a neurologist at the Institute for Neurology and Neurosurgery at Phelps Hospital Northwell Health. Dr. Chaudry, welcome to the conversation. Can you please turn on your camera? Oh, and make sure you come off mute. There you are. Welcome.
Thank you. Thank you for having me.
So Dr. Chaudry, I just read your title with Northwell Health, but before we dive into the conversation, why don't you tell us a little bit about yourself?
Okay, well, I consider myself a general neurologist with interest in headache and stroke management, along with some interest in demyelinating diseases such as multiple sclerosis. So I have been with Phelps Hospital for 2 years, with Northwell Health for 2 years. Majority of my practice was in the Midwest, and then I moved to New York, and so here I am.
Well, we're really lucky to have you, especially because this is a subject that is so important right now. But you know, we always want to set the groundwork, start at the basics. Why don't you tell us, what is a stroke and how do you spot the symptoms?
Okay, that's obviously from a neurologist perspective, that's a very broad question. But
Mhm.
I think for the general population, I think we just have to take a look at what is the most common type of stroke that we see typically. So there's broad category, there's two types of stroke. One would be the ischemic stroke, and one is the hemorrhagic stroke. And for the purposes of our conversation today, I'd like to focus on ischemic stroke. So, ischemia meaning by a lack of oxygen blood flow to this particular area. So, majority of strokes that people hear about, talk about, are ischemic strokes. What is a stroke? It's essentially what happens when a particular area of the brain does not get enough oxygen, resulting in physical manifestations in the body. Sometimes there are things called silent strokes, but again, we're going to focus on what people see and what they experience. So essentially, stroke is when an area of the brain does not get enough perfusion to it. And there's different mechanisms behind that. One could be just when there's just a clot buildup in an artery and that just finally kind of closes down. One is if there's a clot that forms somewhere else in the body and travels and lodges itself in a certain area of the brain. And lastly, if you drop your blood pressure suddenly without warning, that can, depending on how bad it is, can lead to a stroke and predispose people.
How about spotting the symptoms of a stroke?
So the easiest thing, I think that there's an acronym known as FAST. Okay, so face, if there's a facial droop, if there's a loss of strength in the arm, if there's speech deficits, and then T stands for time. Okay, and so of course. In my field and also in many other fields, but specifically in reference to stroke, time is brain. Okay, so the quicker you can get people to the hospital, uh, the better chances are that we could do something about what you're experiencing. But the quickest sign would be if you notice a facial droop, if you notice arm weakness, and I will just go on to say also leg weakness would be considered. But A is just, so people can remember the acronym. And speech, of course, slurred speech, word finding, things that are not making sense are all common large vessel stroke presentations.
Thank you, Dr. Chaudry. I just want to emphasize FAST, face, arm, speech, time to call 911. Time lost is brain lost. Calling 911 immediately can save your life and can help you in the long run. So thank you for starting with that. That is just so crucial. But let's dive into a little bit more about the connection between neurological problems and COVID.
Sure.
So, we're about 14 months into the pandemic, and I know we're learning more about COVID and how it affects our entire body, but does COVID cause neurological problems? Why and how?
Okay. So again, most people are probably just like done hearing about this, but we are, as everyone knows, I'm sure our audience knows too, the coronavirus is a very large group of viruses that have been present for many years. Okay. What COVID now is a novel coronavirus that we have found that has basically kind of spread like wildfire throughout the globe. So the excuse me, I'm sorry. Somehow this is not gonna, excuse me, can you hear all of that is coming?
Yeah, we do. Yep.
I'm so sorry. I'm just
Okay.
let me just get this going where I can stop this here because no matter what I do, people still forget. Okay.
That's what I love about doing these live webinars.
Yeah, exactly. And I'm trying to figure out, and this is where I do not do very well when it comes to managing. There we go. I think it'll now be taken care of. Okay. So going back to the question, COVID, and does it cause neurologic issues? So like any virus, okay, most viruses, if you say if you're sick enough from them that you're sick enough that you get into the hospital or sick enough that you're having effects from it, do cause neurologic illnesses. So the short answer is yes. The long answer is just a little bit different. So yes, it does cause it. Now the question you asked is, well, how? So we're still continuing to learn about the pathophysiology of how the coronavirus affects brain and the neurologic system at large. First things first, that we find out that when most people are severely ill with COVID, and let's just say they get into the hospital and they're having a lot of trouble with breathing, obviously, as everyone knows, it does affect the cardiopulmonary system the most. The associated issues with it affecting the heart and the lungs is that there is hypoxia, so lack of oxygen to the brain. Okay, that will create problems with brain health. It just kind of makes sense. Less oxygen to most organs causes problems, and to the brain is extremely sensitive to that as well. The second is that it's an immune dysfunction that you're dealing with. So there is going to be an inflammatory response that is triggered by the virus. Okay, and finally, there's also evidence that there is direct invasion of the virus into the brain as well. So that's a little bit of that background.
We often say, and I even said it in our intro, that 80% of strokes are preventable with lifestyle change, with things like eating smart, moving more, speaking with your doctor.
Yeah.
And then we talk about comorbidities. So
Right.
what comorbidities are contributing factors to stroke?
Okay, so that is a great question. Okay, and I agree with you. Like a majority of ischemic strokes are preventable. What is the number one risk factor for stroke in the U.S.? That would be high blood pressure. Okay, so hypertension being one, high cholesterol two, diabetes three. Okay, in fact, those are the three things we check for whenever somebody has either a warning stroke, like a TIA, or a stroke itself. And those are the most common contributing factors. Okay, and then also smoking is, I consider it a risk factor indirectly. I definitely think, if one of my patients has a stroke and they're smoking, yeah, that's a risk factor as far as I'm concerned. So the most common things being, that we talk about are high blood pressure, high cholesterol, diabetes. And, people come to me, they're like, well, what can we do? And everybody, a lot of my patients are worried about, well, once a stroke happens, you really have to target those risk factors. And when I say target, I mean, you have to be aggressive about it. Okay? Aggressively targeting your blood pressure, your cholesterol, and all of that can be modified and brought about by lifestyle changes. So it is, I talk about atomic habits when I talk with my patients. It's basically making small changes that will lead to big outcomes, because once you go through such a traumatic event, you want to change everything all at once. And I find that to be very overwhelming. And that's for most of us who don't have health problems either. It's overwhelming to change a habit. So we talk about slow, modifications long term.
And I love that, because we often want to remind people that those small changes add up
They
over in the long term. And the fact that you brought up smoking and smoking cessation as something, I think that's the leading preventable cause of both heart disease and stroke. So I thank you for highlighting that one. Something that we have seen over the last few years, and some of the research, is that while stroke incidence is decreasing in the general population, it's actually been seeing a bit of an uptick in younger adults. So some people in their 30s and 40s are now having strokes. What do you think is the cause of stroke in younger people, younger adults?
It's interesting. I don't know if there's one exact cause. Once again, when we are coming up with things, when we look at just data and we look at the studies coming out, you just go back to the basics. Once again, is it just because younger people are having increased rates of obesity? Is there associated like lifestyle choices that they're making? Is there, or are we just getting better at also identifying strokes when they are younger? So I don't think there's anything specific that would point to like a certain etiology that's more prevalent in our younger population. Again, the most common causes, like we discussed, again, high blood pressure, high cholesterol, diabetes, smoking. Obviously, we talk about that. And anytime a younger individual has strokes, we also look for things like hypercoagulable states that are now more recognized, which is your body's tendency to clot more. Okay. And I don't know, that's something. And if a 40-year-old has a stroke, that's definitely something that we neurologists and hematologists look at very closely. Is there something going on in the blood itself? Is there some genetic component to it? And obviously, always harp back onto lifestyle changes. And I find that to be frustrating for me as a physician, because a lot of times it's hard to, I want to be, I want to be that little angel that sits on my patient's shoulder and try to remind them. And it's also frustrating for patients because it's overwhelming when they have to make such big changes and they have to deal with such a traumatic event like a stroke. So.
And I love that image of kind of being the angel on their shoulder, because I think it's important for us to always empower the patients and survivors, and really have them realize that when they work with their doctor and their caretaker, it's a team effort.
It really is.
And that's why it's important to be open and transparent with you as the physician.
Absolutely. Absolutely.
And of course, if lifestyle changes don't work after a certain amount of time, there's also an opportunity for medical intervention.
Absolutely. But by the time, and this is important for, you bring this up, by the time an individual has had a stroke, they already are supposed to be on medication. So, you're already on the blood pressure meds, you're already on the antiplatelets, you're already on, if you have diabetes or cholesterol, on those appropriate medications. And again, taking even 3 or 4 medications can be daunting and overwhelming for a lot of our patients. So I always tell them, look, this has happened. We already know you have a reason to have this stroke, but let's do everything we can to minimize your risk for future strokes. And hopefully, maybe if we're lucky, we can take you off of some of this if you can actually institute those dietary changes and stick to it. And that's usually the key issue. Is a lot of times it's hard to change habits and then stick to that change.
That is so true. And as we're looking towards the future, and we kind of hone back in or focus back in on the connection with COVID, what are some of the long-term consequences of COVID related to cardiovascular health and stroke risk? What do you think is coming down the line?
So, you know what? It's interesting. It's a really great question. And although we've been dealing with this now for 14 months, that's actually, that's kind of like a blink of an eye for epidemiological data. It's just not going to be enough. Now, the incidence of stroke in patients who have COVID is about 1 to 3%, depending on which study you look at. So, obviously in my field, and I'm seeing a lot of it, but I think my evaluation or my understanding of the pandemic is a little skewed because of that, because I think everyone with COVID, the first thing that pops into my head is stroke, but that's not exactly what we are dealing with. I think the bigger issue, when we do see strokes in patients with COVID, they tend to already have a lot of significant comorbidities. Okay, that just kind of get unmasked when you're dealing with a systemic immune/inflammatory response, and then the treatment of the stroke, treatment of the risk factors remains the same. So there isn't anything that changes as far as management and treatment. What, as neurologists, that we are beginning to see more and more in the outpatient setting is really not the issues from the stroke, but it's what we call brain fog and just the chronic fatigue and those symptoms that are coming. And again, the studies and evaluation and research is ongoing as to what is causing that, what is triggering it, and how we are going to hopefully treat it.
And I think you're so right that we are so early in really understanding what the long-term impact is going to be. I think you hit the nail on the head of the importance of research. And the American Heart Association is the second largest funder of heart and stroke research, second only to the National Institute of Health. So for all of our supporters who are listening, you are, by donating, you're helping advance our understanding of COVID and how it impacts our health. You did mention brain fog, and there has been some literature and some anecdotal evidence that has come out over the last year about brain fog. So what is brain fog first?
So I think it means different things to different people. Okay. And that's just, what, when I have patients and I see patients for other neurologic illnesses, and a lot of times autoimmune neurologic illnesses, patients will describe brain fog as well. And what I'm hearing for my post COVID patients is actually similar. Okay. So what you hear about is just difficulty processing information, getting overstimulated, being slow to answer questions, not having the ability to concentrate as well, and almost like more fatigue from having to think through and do things that were very normal or routine from them in the past. So I consider brain fog any like sensation that they're having cognitive issues, and they're unable to do things as they did prior to the infection.
And so what kinds of brain fog or brain injuries have people suffered as a result of COVID, whether it's what you've read in the research or anecdotally?
So I don't first things, I'm going to take the stroke component out of that particular
Okay.
question, because post stroke, if you've had significant damage or just to the brain, you're going to have problems with word finding, you're going to have cognitive complaints and so forth. So that's post stroke, and I consider that not just a COVID dysfunction, that's a stroke, that is a sequela of a stroke. Okay. What we're seeing is even people who had mild disease, who may not have even been admitted, what they're describing is, again, these cognitive complaints. Okay.
Mhm.
I just can't concentrate as well. I just feel really fatigued afterwards. And generally speaking, we look at these cognitive complaints more seriously after 3 months, after 12 weeks post, if you are still having these issues and there's no other explanation for it. Okay, there's no vitamin deficiencies. There's no other. You don't have another autoimmune illness. Your brain looks okay. Your MRI is fine. You have had no strokes. That's when we say, okay, maybe this is some sort of a long-term post-COVID sequela that people are complaining of. And I think, again, still too soon, 14 months, and that this is going to kind of change as more data gets available. I think the general public is so kind of fed up with all, the different people describe to me different. Well, we're so frustrated. The CDC changes their mind about, what to do, but understand that's what science and recommendations change as more data becomes available. So,
I think it's important to also to say that there is light at the end of the tunnel, where there is a lot of progress that is being made. And I think it's also important to think about what happens after the stroke. Post-stroke is something that you mentioned. And you often hear about cardiac rehab and what people do after they have a heart incident. You don't always hear about what happens post-stroke. So what's the importance of stroke rehabilitation?
oh, it's huge. It's hugely important, especially if you have deficits, okay, in the hospital. So most of the time, depending on how big the stroke is and what is a deficit, if you cannot, cannot be independent, most of the people go to rehab. And stroke rehab is physical therapy, occupational therapy, speech therapy, and those patients who can actually handle pretty, 4 to 6 hours of rehab daily are the ones that go to acute rehab. And whether my patients go to acute rehab or whether they go home, I'm such a huge believer in physical therapy, occupational therapy, speech therapy as they're needed for certain patients, because I do think that the sooner you get mobile and the sooner you target those deficiencies, the better off you will become. In the past, we considered stroke was considered, okay, well, it's an event, it happened, and it's over. Okay. But as the brain is such a fascinating organ, because really it's not over, because it's so, if you do try to do rehab, continue to do those therapy, other areas of the brain do take over and there is improvement. Okay. So the earlier you get to that rehab, the better it is. Just like in cardiac rehab.
That is such an important message. And I also want to take a second to thank all of the caregivers, everyone who is helping stroke survivors get to their appointments and really get on path to making a full recovery, knowing that stroke is the #1 disabler of Americans. So I also wanted to ask you this, because you kind of started talking about it, but what is recovery like for stroke patients who also have had COVID?
Okay. So, again, post-stroke recovery, it can be very stormy and challenging. I think that when you have had COVID and you're in the hospital being treated for COVID plus stroke, I suspect it's a little bit more challenging. Okay. And part of that is because you're also not only just dealing with the physical deficits from the brain stroke, but you also have cardiopulmonary issues, specifically if you've got pneumonia, if you're not having trouble, if you're not able to breathe. A lot of our severely affected COVID patients have difficulty getting weaning off oxygen. And so in that case, the recovery is that much more difficult because not only are you fighting right now to deal with the physical deficits from a stroke, but you're also fighting just to breathe. And that is more, energy requiring than I guess somebody who doesn't have those issues. So it just tends to be more challenging and probably takes longer than than the average person with stroke.
Well, Dr. Chaudry, I know we want to leave a few minutes for some questions and answers from the audience. And so I want to encourage people, if they do have questions, now is your last opportunity to put those questions in the chat box. And while people are typing in their questions, I want to give you the opportunity to share a final word before we move on to the next segment.
So, Diego, are you going to look at the questions?
Oh, I am. I just wanted to know if there was a final word that you wanted to share, like a final statement you wanted to share with the audience.
Yeah. So I think that the key thing is, I know we're in the middle of a pandemic, and of course, everything people worry about is COVID related, but just remember to take care of your general health, to take care of those general risk factors. The healthier you are, the better off you will be able to fight this infection, God forbid if you get it. And so my thing is just really, focus on lifestyle modification, even if you don't have stroke risk factors right now. Moving around daily exercise, eating well, eating like a high protein and high vegetable diet. Probably lean protein, high vegetable diet is probably better. To avoid excessive processed food is probably good. So my thing is really pay attention to your overall general health so you can deal with things in the long term.
Well, that's great advice, Doctor. So we did receive a few questions in the chat box. We also received a few questions via email prior to the conversation. So the first one that I want to ask you, it's very general about identifying the signs and symptoms of a stroke. So first, is weakness of limbs always on one side, doctor?
Okay, so that's a great question. Typically speaking, I would say it's not, if you're talking about a sudden deficit, it typically will be unilateral. There are certain types of strokes where it would just affect your legs or maybe arms. Okay. So typically speaking, I would look at like the onset of the weakness. If you've been having weakness for weeks and it's affecting both sides, it's less likely to have been a stroke. But typically speaking, the weakness is a sudden onset unilateral deficit.
Okay. A question that we received from the email was, someone said, I'm wondering if increased blood pressure or POTS, postular orthostatic tachycardia syndrome, small vessel disease or tinnitus could be caused or exacerbated by COVID. And could any combination of these cause sleep loss and thus mental disturbance?
Oh my gosh, it's a loaded question.
Yeah, there's a lot there. Yeah,
there's a lot to unpack there. So can COVID in and of itself cause high blood pressure? I don't think so. Okay, is my first response. Okay, so that's my first response. Could it lead to POTS, which is the it's a well, we can look at it as an autoimmune dysfunction where people start developing low blood pressure, especially when they stand up, and a high heart rate. So there has been some studies that going on that there may be a trigger from COVID leading to POTS. Yeah, it's a possibility, but we don't understand POTS fully in this context just yet. So first thing is, does high blood pressure come from, can COVID trigger high blood pressure? I don't think so, not in and of itself. second question in there is POTS. I think I think we're going to find out that there is going to be probably some sort of an association with it. Maybe it's unmasking it. And then finally, does all of this cause sleep loss in and of itself? Again, no. But I think that when you look at overall health as it's affected, going through the trauma of having a virus like this, if you've been severely ill, and if you also have comorbidities, yeah, you can have sleep loss. I mean, that's just, that can happen, but I don't think the virus itself causes it, if that's a question.
And I also want to remind our listeners, our audience, that while this is an important platform to talk about these issues, please remember that the best thing you can do is speak with your doctor and ask him or her these questions directly and get the answer that is most tailored to your health needs.
Absolutely.
And with that said, I think we have time for just about 2 more questions, if that's okay with you, Doctor.
Sure.
All right, so another one here we have in the chat box. It's I had COVID in January 2021, and recently I'm having an issue where a few weeks ago I started to smell smoke constantly. Is that a neurological issue due to COVID?
If you've never had it before and it's just happening now, I think that is something that ought to be evaluated. Okay. So, when we basically what you're describing is an olfactory hallucination. Okay. So smelling smoke when it's not there, smelling burning tires that are not there, and that ought to be at least evaluated. So it potentially could have been caused by COVID, or is it something, is this maybe just coincidental? Either way, that's something that really needs to be evaluated. Absolutely. By a neurologist.
And then the last question I want to ask, and I want to thank everyone who submitted their questions. We're going to do our best to answer questions offline, but for the interest of time, because we heard Dr. Chaudry's phone ringing, she is in demand because she is so skilled and valuable. But the last question we have for you, Doctor, is my wife and I had COVID. Do we need to be vaccinated?
Okay, so that's a great question. And eventually, yes, I think this is a question probably best geared towards the primary care physicians. But from what I understand is that after you've had COVID, at least 90 days, you don't need the vaccination, but you can get vaccinated after 90 days. But I would urge you to discuss that with your primary. But that is my understanding there as far as vaccination recommendations.
Well, that's excellent, Dr. Chaudry. We know how busy you are, but it was just excellent to have you share your knowledge with us, even just for this half an hour. So thank you again. So yes, we want to thank Dr. Chaudry for sharing her time and knowledge with us. We also want to thank our presenting sponsor, Phelps Hospital Northwell Health, and of course we want to thank all of you for joining the conversation. And then there's one final reminder: May is American Stroke Month, and it is a perfect opportunity to honor all survivors and the researchers and doctors who are out there helping us better understand stroke by making a donation. And you can do that by texting to donate. Text GORED 914 to 41444 to help advance the mission of the American Heart Association and the American Stroke Association. So on behalf of all of us, thank you very much for joining us. Have a great rest of the day. Take care, everyone.